this. So if a woman comes in and she's having a hard time getting pregnant or endometriosis or something, we usually say, all right, well, what system is probably that should I focus on? And if it's infertility or PCOS, we probably don't think it's her skin or her musculoskeletal system, and you might think it's the brain, but that's not usually the first place people would go. We'd say what system? Reproductive or endocrine system. That would make sense? But it's not. The endocrine system is a bunch of organs. So if we think of that, the heart's an organ. It's probably not the heart that's causing her PCOS. Probably not the thymus. You guys see how that works? Most people would probably start out with the ovaries. What's going on with their ovaries that's causing infertility and PCOS? But an organ is really just a bunch of what? There's only 4. And the ovary, you think it's the muscle in the ovary that's causing her PCOS? Probably not. The connective tissue? Probably not. Neural tissue? Probably not. The epithelial ones are the ones that make hormones, right? But a tissue is really just a bunch of cells. And so you guys understand, I'm very transparent. I saw this and I thought, so if somebody is not feeling well, then maybe it's just cellular dysfunction in the first place. That makes sense. And I went through and I tracked as many conditions as I could think of to see if, well, is type 2 diabetes, is that cellular? Or is autoimmunity cellular? Or is cancer? I went through as many conditions I could to say, if anybody comes in to see me, because I get really confused when I see 278 pages of labs, 11 pages of symptoms, and 4 pages of supplements, where does one start? And I thought, well, what if I start with a cell?